Well, hello, it's Bruce Williams again, and it's 19 May, and it's time for another Gross Path Challenge. Are you ready? I sure am. Slide number 1 is tissue from a foal. How about a morphologic diagnosis? Name this condition and give me the cause. Okay, time's up. I've always said if you can get the entire colon of a horse on a light box, not have to spread it out on the floor, probably dealing with a very young foal, and it probably has this condition, which is known as lethal white foal syndrome. We see lethal white foal syndrome in offspring, usually of two Appaloosas who are carrying the wrong allele, but 25% will be afflicted with this condition. They're called lethal white foal conditions because they are hypomelanotic. They usually have a little bit of pigment. They're not albinos, but they are white. They are often undersized, and they die within a week of flaming colitis because segments of their colon or their small colon or parts of their large colon here are underdeveloped as a result of aganglionosis or a lack of population of the Auerbach's and Meissner's plexi with mature neurons. The morphologic diagnosis is segmental colonic hypoplasia with aganglionosis. The cause is endothelin receptor B mutation. Now, there are two genes that are very important for helping the migration of neurons from the neural tube to their final place here in the wall of the colon. That is the glial-derived neurotrophic factor and endothelin receptor B. Glial-derived neurotrophic factor actually helps the migration. It causes the migration of these cells. Endothelin B prevents their maturation en route. But with a defect in endothelin receptor B, these cells will mature too early. They will essentially get stuck in another location and never make it to their final resting place in the plexi of the colon. So we have a lack of development of this muscle due to poor innervation, and this lesion develops. Lethal white foal syndrome, and another great oversimplification by me. Slide number 2 is tissue from an adult horse. Can you give me a morphologic diagnosis and a cause? Okay, this particular lesion is often seen on the legs of horses, and these horses are usually from sort of swampy areas in the southern U.S., perhaps Louisiana, Florida, Alabama, something like that. The morphologic diagnosis is a multifocal tube coalescing chronic active and eosinophilic dermatitis. The cause is Pythium insidiosum, although I'll be happy to take Zygomyces species as well. Okay, Pythium insidiosum is a mesomycetozoan parasite that lives in wet plant material. And it usually gets introduced into the skin where there are minor wounds, or maybe it's just chronic macerated area because the animal skin is wet all the time. That's why we see it so often around the feet. They're in swampy areas, they get a little bit of a wound and it gets infected with this parasite. The morphologic diagnosis of chronic active and eosinophilic is interesting, and I sort of reserve it for this lesion. Eosinophils are unusual. There are certain animals that like to throw a lot of eosinophils at just about everything, like pigs. Horses, not so much. But there are a lot of eosinophils in this lesion. That's why it's very pruritic. They tend to traumatize it a lot. Chronic active is a modifier that describes a lesion that is been going on for a long time, so there's a lot of fibrous connective tissue, and there are little active hotspots of this eosinophilic and neutrophilic inflammation. So chronic active and eosinophilic dermatitis is what I use for this one. It's an interesting lesion because if you look at those little hotspots, you will see the outlines of these hyphal-like structures with Pythium or actual fungal hyphae with Zygomyces. They don't stain well on an H&E. So you see them in negative relief against the inflammation. If you put a silver stain on it, they'll pop up real well. The reason I take either Pythium or Zygomyces, or in a dog or a cat, I would take Laginidium, is that I've been burned because they all look exactly alike on H&E and silver stains, you can't tell the difference. So you really need to go for culture, which is a long process, or preferably PCR to identify the culprit in this one. Slide number 3 is tissue from a goat. Can you give me a morphologic diagnosis? Okay, time's up. Goats probably have more of these than any other species of animal. They tend to go hand in hand with polled genotypes. And what we're looking at is, we're looking at the reproductive tract that is laid out, and this particular form of laying it out goes all the way back to Dr. Ken McEntee in his reproductive pathology in mammals book back in the 50s. And everybody does it now. We're looking at the vulva here with what appears to be an enlarged clitoris, the vagina, the cervix, the uterus, both horns, and attached to each horn is a large testis with an epididymis here. It's also the bladder sticking up here. Classic way to lay out a pseudohermaphrodite. And the reason we call it a pseudohermaphrodite is that the gonads, which really drive everything in nomenclature here, do not match up with the external genitalia. To be a true hermaphrodite, these would have to be ovotestes and have both the parts of ovary and seminiferous tubules in them. It doesn't look like that's going on. I suppose it could be if we took a section, but these look like pretty healthy male gonads. So this would be a male pseudohermaphrodite. The gonads determine whether it's male or female, and then the fact that the gonads do not match up with the external genitalia determines it's a pseudohermaphrodite. So male pseudohermaphrodite in a goat. Slide number 4 is tissue from an ox. Can you give me a morphologic diagnosis and 2 possible causes? Okay, time's up. I like this picture because whoever took this one many, many years ago, this is an oldie, got it before there was too much necrosis to sort of cover up what's going on here. We're looking at 2 sections of intestine, and the pyrus patches are just gone. They are punched out. There's been diffuse severe lymphocytolysis. There are a couple of organisms that really go after pyrus patches. Eventually, these organisms also lay waste to the regular intestinal mucosa. Catch them early, you'll just see the pyrus patches. And in an ox, the first 2 I'm going to think about are bovine pestivirus, causative agent of mucosal disease, which goes for the pyrus patches first. And then the second one would be Salmonella typhimurium. Acute salmonellosis, like any other hot gram-negative, is going to go after lymphoid tissue first. These hot gram-negatives go after the lymphoid tissue of the gut, mesenteric lymph nodes, and the spleen. That's a classic triad of lesions in hot gram-negative infections. The third one that I was taught, but you don't have to worry about anymore, is rinderpest, or bovine morbillivirus infection that has been vaccinated out of existence. Fingers crossed. So we don't have to worry about that one. But I was taught that because it causes a very similar lesion. Okay, slide number 5 is tissue from a horse. Can you give me a morphologic diagnosis and a cause? Okay, time's up. This was published, I think about 5 or 10 years ago in VetPath. This lesion was first seen and described by Klaus Bergelt, University of Florida, about 30 years ago. And we're looking at the liver of a horse. This one's a little tricky, especially if you've never seen it, because I would first look at this and I would say, well, I see little white tit dots, they're multifocal, coalescing, they're different sizes. I think this is gram-negative sepsis, and I think I would probably go with something like Actinobacillus E. coli or Salmonella or something like that. Is probably a foal. But I did tell you it's a horse. And this is an adult horse. These are usually older horses. The lesions are more common on the diaphragmatic aspect of the liver. And these, instead of being abscesses, these are little mineralized granulomas. If you could feel them, they would feel like little millet seeds or BBs, because they're all mineralized. And they are granulomas. And the morphologic diagnosis I'm looking for is multifocal coalescing granulomatous hepatitis. If you want to say hepatitis, granulomatous hepatitis with mineral, that's fine too. The cause is a blood fluke known as Heterobilharzia americanum, another one that you see in the southern U.S. And you can see it in dogs, you can see it in raccoons, and when you see it in horses, you see this granulomatous, mineralized hepatitis. And if you do an ultrasound, supposedly you'll see a starry sky effect, which makes sense because these are all mineral densities. It's very classic in a number of species, whether it's birds or turtles or whatever, that when you have parasites in the blood, they lay their eggs and they get into portal circulation, they go to the liver, and they often sort of burrow into the portal areas where they, over time, inside an inflammatory response, the eggs will die and they will become mineralized. And it's a great lesion in the horse. I won't say it's a new lesion because it's been around for a while, but it's one that not a lot of people know about, but actually now you know about it. Okay, our next slide is from an ox. Can you give me a morphologic diagnosis and a possible cause? Okay, time's up. We're looking at multiple loops of intestine which are surrounded by this yellowish white, and it even looks hard material. The morphologic diagnosis is multifocal coalescing abdominal fat necrosis with intestinal entrapment. Okay, if you said intestinal or abdominal fat necrosis, I'll give you full credit. But really, this is a major cause of putting these animals down because when they get bowel obstruction. Okay, so a couple of things I wanted to mention. Fat is not normally yellow in cattle. There are a couple of breeds like Jerseys and Guernseys, the Channel Island breeds, who metabolize vitamin A a little bit differently, and their fat is yellow. But normally, in every animal species, it should be white. It only becomes yellow when it's oxidized, when it's partially broken down, and it turns a yellow color. So this yellow color is very abnormal. There are a number of causes of fat necrosis in cattle, sometimes just totally spontaneous, and you can see that in cattle, you can see that in deer. One of the well-known causes, and the one I hope that you wrote down, was as a result of eating fescue grass, which is infected with an endophyte or a parasite in the seed heads called Acremonium cenophalium. Okay, so that's a good one. So if you can see it as real ingested. You can also see it as a genetic thing in certain breeds of cattle, like Japanese black cattle have this. It's one of those things that there's often, it doesn't cause any problem. It's an incidental finding. If they do have a lot, because it gets heavier, it sort of pulls the gut down, and it's tough to palpate if you're a clinician. If it's up high, it's not that difficult to palpate. If it's around the kidney, you can feel it. But if it's around the intestine, it tends to make its way down to the bottom of the abdomen. So fat necrosis as a result of ingestion of infected fescue grass. Okay, slide number 7 is tissue from a dog. Can you give me a morphologic diagnosis and the cause? Okay, time's up. This is one of my favorite parasites. This is the giant red kidney worm, or Dictyophthema renale. Morphologic diagnosis is a diffuse verminous nephritis with hydronephrosis. And that's what happens. The worm gets up inside the kidney and it grows and grows, it gets bigger, it obstructs the kidney, you get hydronephrosis because kidney doesn't know there's a big worm in there. Glomeruli don't know, so they just keep passing urine into tubules and it never goes anywhere. The pressure backs up, and you know that it takes, once you have 2 weeks of obstruction, most kidneys are shot forever. So, and then you can see this usually It is in areas of water. On one sec. Okay, sorry about that. Phone's blowing up. So as we said before, usually it's seen around water. So you see it in a lot of animals that are around water. In wildlife, you can see it in mustelids or raccoons, or but dogs and cats are certainly susceptible to it too. So that's Dioctophema renale, the giant red kidney worm, and supposedly people will get this too, and you don't know you have it. It's just totally incidental. So if I were you, I would run right out and get myself an ultrasound of my kidneys. Make sure that you don't have one of these growing inside you. Okay, slide number 8 is tissue from a sheep. Can you give me a morphologic diagnosis and a cause? Okay, time's up. These are always tough. And if you are going to take certification examination, you are sure somewhere in there to get a sheep lung. And usually when you see something like this, the two major differential diagnoses are going to be pulmonary adenocarcinoma versus a lentivirus-induced pneumonia or progressive pneumonia. And when you see one that looks like lymphoma, you see something that looks like a sort of grayish tumor, as in right here, probably going to be pulmonary adenocarcinoma. It is caused by a exogenous beta-retrovirus in sheep, and you can see that there are, give you a preview of the next one, a lot of little areas here which have a similar appearance, but you have this large focal area. Now, if you look around at the periphery of all this, you'll see that it's dark because this often engenders a tremendous amount of edema as well, and macrophages. And these animals have a tremendous amount of fluid in their lungs. It's called the Ixicti or driving sickness, first identified in South Africa. The reason it's called driving sickness is these animals with all the fluid in their lungs and the tumor would always lag behind the other ones. They would always be the last ones to come in. And when they came in, and if you picked them up by the hind legs, held them up like that, you get all this fluid come out of their nose because the exercise would mobilize and generate even more edema. So it is a beta-retrovirus which causes pulmonary adenocarcinoma. It looks just like an adenocarcinoma with the sort of cuboidal proliferation of poorly differentiated cells from the terminal bronchiole, exhibiting lipidic growth and growing up into all the alveoli. Classic adenocarcinoma, great example of a retroviral-induced neoplasm. Remember that sheep also get nasal adenocarcinomas in their nose, which is also retroviral-induced. So got a lot of retroviruses, those sheep do. Oh, here's another great picture. This is tissue from a chicken, or obviously tissue from multiple chickens, because I don't remember any chickens having 3 drumsticks. There were some in Ripley's, believe it or not, maybe. But we're going to say these are multiple chickens, and I need a morphologic diagnosis, and I want the name of this condition. Okay, time's up. Hey, for those of you who carry a pocket knife, if you ever go to eat chicken at Popeyes or Kentucky Fried Chicken, this is something you can check for. And you can even see the lesion if it's there, because you're always going to have the drumsticks. So just take your pocket knife and cut the end off. Amaze your friends if you find it. Okay, so this is what appears to be sort of a normal control here. This is a moderately affected individual, and there's a severely affected individual. The condition is known as tibial dyschondroplasia. And what we're seeing is a large area of retained cartilage from the growth plate. And what happens is that the hypertrophic zone does not break down, and it continues to elongate and elongate and elongate, and you end up with this large unremodeled area of physiocartilage. The morphologic diagnosis that I like for this one is retained physiocartilage core with excessive zone of hypertrophy. Okay, gives you the morphology. It sounds so much better than just saying chondrodysplasia. Back in the day when I took the test, everybody used to write chondrodysplasia whenever you saw anything like rickets or this or vitamin C deficiency, scurvy, and we got away with it. But I think the test is more discriminating. You need to know, or at least let the grader know that you know this lesion. So retain physeal cartilage core. So what's going on here tells you that you can identify this wedge, but with retained zone of hypertrophy or something like that tells you you also know what the lesion is. So chondrodysplasia is not going to do it for you anymore. Slide number 10 is tissue from a cat. Can you give me a morphologic diagnosis? Okay, time's up. This one should be fairly straightforward. Of all the brain tumors, all the tumors of the cranium of the cat, 80 to 90% are going to be meningiomas. They're not really brain tumors. They're tumors of the skull, and they're fairly common in cats. In cats, they tend, remember, these arise from the leptomeninges, specifically the pia-arachnoid, and they are tumors which grow outward. Okay, but you don't have a lot of room going outward. You're going to hit the skull, but they continue to grow, and so the base pushes down onto the brain, causing pressure atrophy. We don't have the brain here, so that's not part of the morphologic diagnosis, but it's very common. So when they took the brain out of this cat, you would see this divot where this tumor was. As opposed to dogs, these are very benign tumors. They don't act in a benign fashion because of where they're located, but they don't infiltrate the underlying cortex. You can see that in dogs where they actually are fairly aggressive and they can infiltrate into the brain tissue, not in cats. So, but they are a problem because of where they are located. So meningioma in a cat, very classic lesion. And that brings us to the end of today's Growth Path Challenge. I hope you enjoyed it, and I hope you'll come back and look at more Growth Path Challenges with me. I wish you the best from here in North Bethesda. We are still sheltering in place. Where I live, Montgomery County has maintained its stay-at-home rule because we are a fairly urban area of Maryland, and we have not seen the decrease in cases that some of the more rural areas. So here I am, but I'm having a great time here doing a lot of pathology work and, of course, putting together these Growth Path Challenges. Thanks so much for your time, and we'll see you next time.